Hi, my name is Dr. Joanne Kenny, and today I'm going to talk about the use of neuroimaging technology in schizophrenia. I'm going to talk about the use of neuroimaging or brain imaging technologies in trying to understand schizophrenia and discuss if it can be used to diagnose the condition. Schizophrenia is a very complex disorder with a mix of positive, negative, and cognitive symptoms. A lot of brain imaging research has been conducted in schizophrenia, especially in the last 20 to 30 years with the advent of modern neuroimaging techniques and higher quality brain imaging. So schizophrenia is increasingly viewed as a disorder of brain development, and this research is trying to find what are the differences in the brains of people who have a diagnosis of schizophrenia compared to people without a diagnosis. So as I mentioned, schizophrenia is a really complex disorder, and the causes of schizophrenia are still not fully understood. So we know that genetics, the environment, changes in brain structure and function, and an imbalance in brain chemistry all contribute to the risk of developing the condition. So schizophrenia has a heterogeneous etiology involving a complex interplay between all these factors, between genetics and environmental risk factors. So when we talk about if neuroimaging can be used to diagnose schizophrenia, an interesting analogy to look at is if we compare diagnosing in general medicine to a psychiatrist making a diagnosis in psychiatric conditions or schizophrenia. And if we look at this analogy, we can see we're still quite a long way off from using neuroimaging to diagnose psychiatric conditions. So if a doctor suspects that a patient has a broken bone, they typically take an X-ray to be sure of the problem, so to confirm that they do have, in fact, a broken bone. But in treating mental health issues, doctors typically don't take a picture of the brain. So they diagnose the condition based on the clinical presentation of the symptoms. So there's not yet a clinical tool for diagnosing schizophrenia. And this is a really good graphic for understanding this concept of reverse inference. So we see a physician can diagnose a patient with an arm fracture based on clinical symptoms. So based on their physical symptoms, they can make this diagnosis. And then in return, the radiologist can confirm the diagnosis by showing this fracture on an X-ray. However, the psychiatrist can diagnose schizophrenia or other psychiatric conditions based on the clinical symptoms, doing clinical interviews, surveys, questionnaires. But the psychiatrist is unable to deduce the clinical presentation on an MRI scan. So a radiologist is unable to diagnose a person with a diagnosis of schizophrenia based on the MRI findings. So this is because it lacks, the disorder lacks visible pathology in MRI scans. So it's not to say that there aren't differences in the brains of people with schizophrenia compared to people without schizophrenia, but they're generally more subtle and spread throughout the brain, and they're not visibly viewed on an MRI scan. So there isn't a clinical tool for diagnosing schizophrenia just yet. And specific markers and biomarkers that could be used to diagnose schizophrenia haven't been completely identified. That's not to say that there couldn't be. There is a lot of promise for this technology in the future, but we're just not there yet. So I'll talk a bit about the brain imaging technologies that are commonly used when studying schizophrenia. So specifically, I'll focus on MRI or magnetic resonance imaging. So MRI is commonly used to study brain structure and function in schizophrenia. It uses magnetic fields and radio waves to provide a detailed scan of the brain, and it's a non-invasive technique. So there's no radiation like in CT scans, but it is an expensive technique. So different types of scans that we can have are structural magnetic resonance imaging, and that examines the neuroanatomy and pathology of the brain. And with structural MRI scans, we can study the gray matter structures and the white matter regions of the brain. Another type of MRI is functional MRI, and that examines brain activity. So it evaluates the blood flow in the brain, called the blood oxygenated level dependent contrast technique. So this is used in studies of schizophrenia where they want to examine brain activity when the person is doing a particular task. So diffusion weighted imaging is an advanced variant of magnetic resonance imaging. And it's based on the measurement of the diffusion of water molecules. And diffusion tensor imaging is a specific type of modeling of the DWI datasets. It allows us to reconstruct white matter tracks in the brain. And we can study these white matter tracks in more detail compared to a structural MRI scan. So it can provide unique insights into brain network connectivity. So it was developed in the early 1990s, and since then has been applied in a wide variety of scientific and clinical settings, especially, but not limited to, investigations of brain pathology in schizophrenia. So what exactly are the brain changes that have been identified in schizophrenia? So what has neuroimaging research revealed as the main differences in the brains of people with a diagnosis of schizophrenia? So very commonly reported difference is enlarged ventricles. So brain ventricles are among the most studied structures in psychotic conditions. But the mechanisms that lead to ventricular enlargements is mostly unknown. And this finding of enlarged ventricles is one of the most reproducible findings in schizophrenia. One thing to note is that these findings are based on group averages, and historically the sample sizes haven't been too large. So not every person who has a diagnosis of schizophrenia will have enlarged ventricles. And there's a lot of overlap with normal variation in the size of the ventricles. And it's not a consistently reported finding, but it is one of the most commonly reported findings in schizophrenia. So the problem with looking at group averages, when they get a sample of people, a certain number of people with a diagnosis of schizophrenia, and they look at the group averages of their brain scans, is that there's practical problems in using generalized findings from research to interpret results for individual patients. So key issue for many research studies in schizophrenia is that neuroimaging differences are usually quantitative rather than qualitative, and they're evident at the group level rather than at the individual level. So a major objective of future work is to develop personalized psychiatry, which is where the field is going at the moment. So the ENIGMA Consortium, which is the Enhancing Neuroimaging Genetics Through Meta-Analysis Consortium, is a worldwide collaboration. It includes 1,400 plus researchers from 43 countries around the world. And they seek greater power to identify changes in the brain in numerous psychiatric and neurological conditions, including schizophrenia. So these studies include large number of sample size. So this study from Van Erp in 2018 had a sample size of over 4,000 individuals with schizophrenia and 5,000 healthy controls from 39 centers worldwide. And from their findings, they found that individuals with schizophrenia had widespread thinner cortex and smaller surface area. But the largest effect for both was in the frontal and temporal lobes. So another study by Van Erp et al., as part of the ENIGMA consortium, looked at subcortical differences in schizophrenia. So this study had about 2,000 individuals with schizophrenia and about 2,500 healthy controls from 29 centers worldwide. And using MRI scans, they reported that individuals with schizophrenia had smaller hippocampus, amygdala, thalamus, accumbens, and intracranial volume. And they also reported enlargement in other regions, such as the caudate, putamen. And we see here the largest difference was in the lateral ventricles. Another study from the ENIGMA consortium by Kelly et al. Looked specifically at white matter differences in schizophrenia. And they looked at 1,900 individuals with schizophrenia and 2,300 healthy controls from 15 centers worldwide. And they found significant reductions in fractional anisotropy. FA is a metric of a measure of microstructural organization in white matter tracts in the brain. And they found significant reductions in this measure in individuals with schizophrenia that were widespread throughout the brain. So it was detected in 20 of the 25 regions of interest. So what are some of the key points that we can take away from all this research that's been conducted using neuroimaging in schizophrenia? So neuroimaging studies have shown substantive evidence of brain structural, functional, and neurochemical changes in schizophrenia. So it's consistent with the neurodevelopmental model of illness. And it seems that these observed changes are not regionally specific, so they're not located in one region, but they seem to be more pronounced throughout the brain. So in the association cortex, like the prefrontal, parietal, and temporal regions, and subcortical regions like the limbic and striatal brain regions. However, at this time, the individually observed changes in the brains of people with psychiatric disorders, they're not sufficiently specific to be of diagnostic value. So neuroimaging studies have the potential to be used for the prediction of outcome and treatment response across several domains of treatment. So what this paper suggests is that future research should pay attention to multivariate machine learning approaches, multi-site consortia for large sample sizes, such as the ENIGMA consortium, for prospective studies, and novel approaches to address emerging models of genetic, synaptic, and neurochemical models of schizophrenia pathophysiology. So as I touched on in the last slide, the use of artificial intelligence like machine learning for precision psychiatry is a really important topic at the moment. So this can help us translate complex patterns in big data or large amounts of data into clinical relevance in psychiatric conditions. So basically, it would help us to use algorithms to predict who will develop a psychotic disorder. And it can provide patient-level predictive analysis. So unlike looking at group averages, it has more of an individual predictive capability. What are some other future directions for psychiatric disorders like schizophrenia? Well, other studies have shown that urbanicity, social status, migration are all risks as well for schizophrenia. And some studies have shown that improved social interactions, movement, and exposure to green space can mitigate the risk for developing schizophrenia. So a recent population-based study in Denmark found that the cumulative childhood exposure to green space is a protective factor that reduces the risk of developing schizophrenia during adolescence and adulthood. So if you'd like to read more about the research that I presented in this short lecture, you can find the references here. And thank you for watching today. If you have any questions, you can contact this email address here. And if you want to follow me on social media, you can follow me at this.